A lot of people struggle with chronic illnesses or progressive life-limiting illnesses like dementia or Alzheimer's or Parkinson's disease, and they can feel a sense of hopelessness, helplessness. Maybe you or someone you love feels like you have run out of options. Something that is a realistic option is VSED. Let's talk about it. So what is VSED and how can it be a realistic option for you? VSED is voluntary stopping eating and drinking, and it's legal in all 50 states in the US. Many people are suffering with chronic or incurable progressive diseases, or you're the caregiver caring for someone with these diseases, and it feels like there's not much help out there. You may feel out of control or like you have lack of control. There aren't many options for you. People with life-limiting illnesses like dementia, Alzheimer's, Parkinson's disease, they don't qualify for medical aid in dying. They basically are at the mercy of this disease, and they don't want to be. Not everyone wants to be. And I feel like many people don't know about the option of VSED. That's why I feel like this video is so important, so we can understand what is VSED, how does it work, how can you do it if you choose to, who is eligible. I want to help you understand how this can be a realistic option for you. So what do I mean when I say voluntary stopping eating and drinking, which is VSED? It kind of sounds self-explanatory, but let's just be super clear. This is when someone consciously chooses to stop eating and drinking to hasten their death. And this is legal in all 50 states. Now, I cannot stress this enough. You have to have medical professionals involved, because this will not be a painless death if you don't. So you need to have professionals involved and other healthcare workers involved. In this video, I will go over who is eligible, how to go about doing it, and what it will feel like when you do it. What are the symptoms? How will you feel when you stop eating and drinking? So who is eligible? It's not just for people who are terminally ill, and you don't have to have 6 months or less to live. Now, I will say it will be easier for you to get medical help and prepare for this if you do have some kind of terminal illness and you do have 6 months less to live. It'll find it easier for people in the healthcare system to want to work with you. However, basically anyone who is mentally capable of making a decision can qualify for this as long as you have some kind of life-limiting or chronic illness that you have been struggling with. And you can clearly state and clearly prove psychiatrically that you are well enough to make these choices. So basically anyone with like a chronic life-limiting illness could qualify for this, but the more you have to prove to the medical system that you really are ill, the harder it will be to get medical help to do VSED. For example, if you had a chronic illness, but not necessarily dying within 6 months of this chronic illness, but you didn't want to live with this chronic illness anymore, you could qualify for VSED. However, in order to get medical help, meaning like to get hospice involved and get your doctor involved, people to sign off and be okay with this, and give you medications to help with some of the pain or maybe the anxiety of it all, you would likely need to go through a series of questions and tests and maybe see a psychiatrist, so everyone can prove that you have the mental capability and you're not just going through a depressive episode or something because of the disease, to prove that you truly can make this choice and it's something that you really want. So VSED is an option for many people. The specific diseases that I think about when I hear VSED are patients with dementia, Alzheimer's, Parkinson's, MS, any kind of chronic illness. Again, this is a personal choice, but I feel like it's important that we're educated to know that VSED even exists. What will it look like if you choose this option? So the exact process of dying from VSED will unfold differently per person, however they choose to do it, but this is generally how it will look. And I have been told that on your death certificate, it'll say dehydration. It will not say the disease you're dying from, just FYI. Some people only want to stop eating, right? They don't want to really stop drinking. They don't want to have that feeling of thirst. They want to just stop eating. I have been told, and I have read, because I have never had a patient do this, but I've been told by other people and just through my research that just stopping eating you can do, and you can still continue to drink. However, it will prolong the process and make it a little more uncomfortable, I've been told. So people who do this a lot always say they advise people really do, if they want to do it, stop eating and stop drinking. That will quicken everything up and you will have less symptoms. However, it's your choice. You can do whatever you want. Once you truly stop eating and drinking while having medical professionals help, first you will feel the feeling of hunger pain. Now, it depends. If you've been someone who's had a chronic illness, or you've been dealing with some kind of metastatic cancer and you haven't been feeling hungry anyway, some people don't even notice. Some people are happy to stop eating because finally they don't have to eat. They may not feel hunger pains at all, but some people will feel hunger pains the first few days. So you do start kind of just going about your business, but not eating and drinking, and you feel almost normal. Maybe a few hunger pains here and there, a few pings of thirst. And then after a few days, 3 to 4 days, you start feeling more weak and more tired. So as time progresses and you're not fueling your body with food or water, because you're usually already ill on top of that, there is a change in you and you do notice it. You will have, like I said, the hunger pains, lightheadedness, maybe some dizziness, weakness. But generally speaking, most people doing this are already pretty ill and feeling that way anyway, so it might not be that big of a difference. But the main thing you're going to be feeling is lightheadedness, lethargy, tired. So you'll be sleeping a lot, not getting up that much, and then eventually your body will go into the actively dying phase like it would any other way. So you're just hastening your death by not eating and drinking. So the dehydration from the VSED, the not eating and drinking, will eventually affect your kidneys and your heart, and your other organs will start to shut down just as they would if you were actively dying. So like I was telling you before, the things that can affect this are the disease that you are choosing to do this because of. So if you already had metastatic cancer and were already not really eating and drinking, you were already weak, your body may kind of slip into this a little more easy. You wouldn't notice it as much versus someone who was basically well, except for this one chronic illness. Right? They may live a little longer during VSED. They may have more symptoms of hunger or thirst, feel it a little more. So it just depends on the person. You know, age matters, the disease matters, personality, of course, matters, height to weight ratio matters, if you have fluid retention or fluid overload. So all of these things come into play, hence why it's so important you do this with medical professionals. What I find inspiring about this information is that I feel like it'll really help people who feel like they have nothing left. Like when I first learned about this, I thought of my dementia patients, and anyone with dementia or Alzheimer's would be a candidate for VSED. They can write specific details in their advanced directives about what they would want if they stop being able to feed themselves, which eventually all people with that disease will not be able to feed themselves. And they can directly put it in their advanced directives that they do not want to be fed in any way. And they can start the VSED process, and that can hasten their death, which to me, if that's what they want, I love that that is an option for them legally. Another option, as long as they are of sound mind, is them just choosing to start VSED. So if you are of sound mind and you got diagnosed with dementia or Alzheimer's and you didn't want to go through that process, I would strongly suggest you work with a medical professional, but you could choose to do VSED to hasten your death because of this disease. So that is an option for someone that gets a diagnosis of dementia, Alzheimer's, Parkinson's disease, MS. Again, I'm not pushing this. I just want people to know that that is an option that they have if they choose. So if you are a caregiver helping someone with VSED, here are the main things that you will likely hear from them. The main complaint is thirst or dry mouth. Now you can work with a medical professional to help with the thirst and dry mouth. And it just depends on what the person who is doing VSED wants to do. Because of course they can use sponges to help moisten their mouth. They can use ice chips, popsicles, but that is liquid. That is some form of hydration. So some people will be more strict than others, and you just have to listen to the person who's doing the VSED about what they want. There are also medications that the healthcare professionals can help with to help minimize those symptoms and make the person as comfortable as possible during this process. So as caregivers, I think the main thing is just to prepare. Remind yourself that this is what your loved one wants and support them the best way you know how, by just being there for them and asking questions to the healthcare professionals when you do need help. And also remember that there'll be medical professionals helping you, so there are medications involved which can help make the person going through VSED a little more lethargic, a little more sedated, which will help minimize symptoms. So how do you get this started? How can you make this happen if this is something that you're interested in? You have to talk to your medical professionals, the one that you're working with. You have to get your advanced directives in order. There are so many resources out there to help you with VSED because it's very specific and not many people know about it. So in the description of this video, I will have several resources to help you get started if this is something you're interested in. But please know it's important to always have your advanced directives legally done, specifically if you want to do something like VSED, because there is a fine line here with VSED. It is legal, but you need to have everything, all your ducks in a row, so everyone working with you feels comfortable. You can also think about making videos of yourself stating what you want. So if you ever do become incapacitated, there's videos saying what you want. So for anyone out there who is struggling with a terminal or life-limiting illness and you feel hopeless or helpless or like you run out of options, this could be a realistic option for you. For more information, you can click the links in my description.